Now, other mechanism by which the gating of these channels can be done is by a ligand. So, these channels are known as ligand gated channels. So, for this, these channels should have a site for the ligand or the chemical to bind to it. So, this here it is shown the site for binding of the ligand. So, suppose these neurotransmitters are the ligand for this channel and they come and bind to the channel. So, once that happens, the channel opens. So, in this case, this is a ligand gated channel, and because it is allowing the entry of sodium ion, so this is a ligand gated sodium channel. So, some examples of this kind of channel are acetylcholine gated sodium channels, then there are GABA gated chloride channels. Then other types of channels are mechanically gated channels. So, suppose there is some stress on the wall, that is the cell membrane, then these channels will open. So, one example is hair cells in cochlea, which if there is a pressure wave, sound pressure wave is there and it causes the movement of the membrane over these hair cells, then these hair cells move and they have channels which then open. So, yes, this is an example of mechanically gated channels. Okay, till now we talked about different types of gated channels, that is the voltage gated channels, then ligand gated channels and mechanically gated channels. But the membrane also has leaky channels. So, as the term indicates that these channels are not gated, so they are always open. So, one example is potassium leaky channels which are present on the membrane, and they are very important for generation of resting membrane potential. So, we have seen that facilitated diffusion occurs via channels, that is mainly ions move via channels, and then for other molecules there are carrier proteins. But what are the features of this facilitated diffusion? So, first feature of facilitated diffusion is that it follows saturation kinetics. What is that? So, for this, let's try to understand these graphs. Say suppose here x-axis shows extracellular concentration and y-axis shows rate of inflow. So, here we are assuming that suppose intracellular concentration is nil for the substance. Okay. So, you see the graph of simple diffusion shows that as the extracellular concentration is increasing, that means as the concentration gradient for the substance is increasing, the rate of inflow, that is rate of the transport of the substance, is linearly increasing. It is a straight line. So, if extracellular concentration keeps on increasing, the rate of inflow will keep on increasing. So, that is the simple diffusion. This type of graph is known as linear kinetics. That means substances which are transported by simple diffusion follow linear kinetics. On the other hand, you see the graph of facilitated diffusion. The x-axis is showing extracellular concentration, same as here, and the y-axis is showing the rate of inflow. Now, you see that for some time, that means for some value of extracellular concentration, this graph is linear, right? So, rate of inflow is linearly increasing with extracellular concentration. But after some time, this graph is a plateau. That means, despite increase in extracellular concentration, the rate of inflow is not increasing, right? So, for some time this is linear and then it becomes a plateau. So, that is the saturation which has reached. That means, the rate of transport has reached a saturation maximum limit. So, this is known as saturation kinetics. By the way, why this is occurring? Simple. See, in simple diffusion, we said that the substances which cross the membrane will be following simple diffusion. That means lipid soluble substances will be following simple diffusion. But for facilitated diffusion, we said that there are either channels or carriers. So, this maximum rate of the transport in facilitated diffusion is limited by the number of carrier proteins which are present. Okay. So, there are limited number, it cannot be infinite number of carrier proteins which are present on the membrane. So when they become full, right, if they are operating at their maximum limit, rate of transport cannot increase further despite increase in the extracellular concentration. Then second feature of facilitated diffusion is that it is specific. For simple diffusion, we said that any substance which is lipid soluble can cross the membrane, but here we have carrier proteins specifically for a particular substance, and because of that same reason, facilitated diffusion follows competitive inhibition. So, specific means these channel proteins, there will be maybe channel proteins specifically for sodium ions or specifically for potassium ions. So, we call it potassium channels, sodium channels or chloride channels. Similarly, carrier proteins are also for particular substance. Say suppose GLUT transporters, they will transport only glucose and not other carbohydrates, also not fructose, only glucose will be transported. But if there is a substance which can compete with this substance, it has similar structure as same of the substance, then what will happen, that other substance with the similar structure can also bind to the binding site on the carrier protein. So yes, the facilitated diffusion follows competitive inhibition. So till now you might have understood that when we are talking about these proteins, fundamentally any transport mechanism which is using the proteins will follow all these features. That means it will follow saturation kinetics, it will be specific, and it will also have competitive inhibition, because we will be seeing later that active transport mechanisms are all by these proteins only. It cannot happen through the membrane directly.